Hi, and welcome. In this video, we are going to review the nomenclature of the bronchopulmonary segments and discuss why it is important. By the mid-1900s, the practice of excisional pulmonary surgery had become progressively more selective in preserving pulmonary tissue. What I mean by that is, thoracic surgeons started substituting lobectomy for pneumonectomy in many malignancies, and segmentectomy for lobectomy in infections and other segmental diseases. But the nomenclature of the bronchopulmonary segments was not clearly established, and the need for a clear definition of the anatomy and nomenclature was critical. So, a group of physicians from different specialties, ENT, thoracic surgeons, anatomists and bronchosophagologists met in 1949 in Great Britain, at the International Congress of Otorhinolaryngology, and agreed on the nomenclature that we know today. Each bronchopulmonary segment is given a name and a number. So, let's review this. This view is just below the vocal cords, showing the subglottic space, then the trachea. The trachea is generally a midline structure, displaced slightly to the right at the level of the aortic arch. We can appreciate the cricoid cartilage, which is a complete ring. The trachea starts distal to the cricoid cartilage. In adult, it has between 18 to 22 C-shaped rings. Distal to the trachea is the main carina, or C1. The trachea bifurcates into two main bronchi, the right mainstem bronchus and the left mainstem bronchus. The right mainstem bronchus is located between C1 and the secondary carina, or C2. It is shorter, wider and more vertical than the left mainstem bronchus. The right upper lobe takeoff can be seen at 3 o'clock position. This is the right upper lobe view, which generally looks like the Mercedes sign, and divides into 3 segments, the apical segment, or RB1. The posterior segment, or RB2. And the anterior segment, or RB3. Past the right upper lobe, and distal to the bronchus intermedius is the right middle lobe and the right lower lobe. The right middle lobe divides into 2 segments, the lateral segment or RB4, and the medial segment or RB5. The right lower lobes divides into the superior segment or RB6, the medial basal segment or RB7, the anterior basal segment or RB8, the lateral basal segment or RB9, and the posterior basal segment or RB10. Note that the right middle lobe is opposite to the superior segment of the right lower lobe. Moving to the left side, this is a view from the distal left mainstem bronchus. As we described earlier, the left mainstem bronchus is more horizontal than the right mainstem bronchus. It is also longer and narrower. It divides into the left upper lobe and left lower lobe bronchus. The left upper lobe bronchus subsequently divides into the left upper lobe division and the lingula. The former gives rise to the apical posterior segment, LB1 and 2, and to the anterior segment, LB3. The lingula has 2 segments, the superior segment LB4, and the inferior segment, LB5. The left lower lobe bronchus divides into LB6, which is the superior segment, LB7 and 8, which is the anteromedial segment, LB9, which is the lateral basal segment, and LB10, that is the posterior segment. The anterior and the medial segment were noted to arise from a single bronchus, thus given the combined name of LB7 and 8. This concludes our video. We just reviewed how to name the bronchopulmonary segments. Knowledge of the bronchopulmonary segmental anatomy is a prerequisite for accurate radiographic interpretation, detailed bronchoscopy report, and successful surgical lung resection. Thank you very much for your attention. Goodbye.